Okay, what about traumatic and toxic causes of abdominal distension? Blunt abdominal trauma, okay, which can lead to hemoperitoneum. So if you are told that maybe the patient was in a car, was involved in a car accident, whatever, or post-traumatic bowel perforation, or toxic megacolon due to Clostridium difficile or inflammatory bowel disease, right? So how will that present? Abdominal trauma leading to hemoperitoneum. Think about any patient who was in a trauma, right? Who presents with low blood pressure, maybe some palpitations, increased pulse, right? The patient is almost comatose. And then post-traumatic bowel perforation. Think about a patient with trauma plus rigid abdomen. What about toxic megacolon? Look for that patient who presents to the ER with fever, abdominal distension, with some diarrhea, and you are told that maybe the patient has inflammatory bowel disease or recent C. difficile infection. Think about those. Think about those as the reason why the patient is presenting that way. And what about endocrine causes? What about endocrine causes? What about endocrine causes? If the patient has hypothyroidism, diabetes leading to gastroparesis, Addison's disease as well, which can lead to, fluid retention, and then Cushing's syndrome, where the patient has, central obesity. So I've just put the features here. Hypothyroidism, think slow, everything is down. So they are not passing stools well, okay? And because of that, they develop this distension. Diabetes, the patient has poorly controlled diabetes, and because they bloat easily after meals. That's what we call gastroparesis. Addison's disease, think about a patient with hyperpigmentation, low blood pressure, abdominal distension. You've given your fluids. The patient's hypertension is not correcting. Think about an Addisonian crisis, right? Abdominal pain, low blood pressure, which is not correcting with regular IV fluid unless you give a steroid. Think about adrenal insufficiency. And then Cushing's syndrome. Think about that patient who has a moon face, abdominal distension. That patient who has all these features but has thin limbs. The limbs are thin.